Hi, welcome to K&K Speaks. My name is Katie Shaw, and
I'm Rebecca Booth.
thanks so much for tuning in. This episode is going to be on a little bit more serious, kind of more somber topic. This is a very prime example of why I wanted to do the podcast, about talking about things that just are not talked about, that I really feel that need to be talked about. We're going to be talking about miscarriages and infant loss today, a very difficult topic to talk about. Even though it's very difficult, I feel that it's very essential that we talk about it, and it needs to kind of be more talked about. It's very taboo. I feel it's like very hush-hush, swept underneath the rug, but it's very real. It's very experienced by many, many people, many couples. It's kind of has a ripple effect too. Not only do like a person or couples experience it, but it's kind of that ripple effect. It affects the surviving children within the family. It affects the grandparents, aunts, uncles. So I feel like it's really important to talk about today. So what exactly is a miscarriage? I know most of us probably do understand that term, but since we're just covering this topic, again, I feel like that education is needed. So the term miscarriage is a loss of a pregnancy that's anywhere from conception to 20 weeks of the pregnancy. It's most commonly diagnosed, or it occurs between the 7 and 14 week mark within the pregnancy. This actually did not know when kind of preparing for the podcast that miscarriage is actually a type of birth. And it is very, very painful, like labor, when actually it would be like a full term delivery or delivery of some kind. Symptoms are the bleeding, spotting, severe cramping. So that's something that I actually did not know, is that it's considered a type of birth.
Yeah. Yep. Yes.
Yeah.
Yep.
But I did not, I guess that term just kind of didn't occur to me. So to kind of think of it in that terms. So that to me, I learned something new while preparing for this. I am going to kind of read directly from some material. Sometimes I don't like to do that, but I found some phenomenal material and kind of what made me want to do this topic. I actually was at a continuing education kind of like seminar, and there's two sources, I guess. One is the Star Legacy Foundation, and I can't tell you how much I am very impressed with some of these resources that I found. It's very difficult to find some information kind of out there that really kind of speak. I don't see it like displayed very much, I guess, to me. But I'll kind of get into this a little bit later, but one of these is kind of like a resource guide where it just has all kinds of resources kind of in one packet across the state of Iowa.
You want to hold that up so we can get a...
Yes. So we'll kind of go into this a little bit more, and we can make kind of scan the resources and make sure those are available, because this is just wonderful what they did. And like I said, I know we're kind of focusing more on the state of Iowa, but I know that there's, probably outside of the state of Iowa as well. But I just was so impressed with them specifically, and I'm sure there's other agencies and foundations and other places out there that also probably produce this type of thing, but I just was really impressed with this. And the other one was actually put out by Rose Carlson and Kathleen Lemert. They were nurses, and the National Share Office. So this was also a book, just kind of like a small little kind of reader share. And it was by the Share Pregnancy and Infant Loss Support. Share and the Legacy Foundation kind of go hand in hand from what I understand. So again, these two, I just was so impressed to kind of have at hand, not only for a provider, but also for someone that may be going through it. Again, family, friends that are trying to support and trying to understand kind of what's going on. So to kind of circle back, so to kind of go through, but there's some different types of pregnancy, and then there's some different types of miscarriage. So there's just kind of not one overall miscarriage. There's kind of some different types. So there is some different types of pregnancy that could cause then a miscarriage because of the type of pregnancy. So one that may be common that some of you may have heard is an ectopic or tubal pregnancy. And again, I'm sorry, I'm just going to kind of read from here, but it occurs when instead of attaching to the woman's uterus, the fertilized egg attaches itself to a fallopian tube or some other place inside the abdomen. Usually the first sign of this is severe pain in the lower abdomen with or without bleeding. So this can cause severe, possible life-threatening because sometimes the fallopian tube can burst.
Yep. This irritates my soul.
Okay. I know there's a lot of political agendas around.
Not an agenda.
Not
Okay.
agendas, but
I know. We're not going to get political.
yeah, we're not going to get political.
I want to.
Yes, you'll try not to. A molar pregnancy, I didn't really know about this, but may occur in two ways, complete or partial. A complete molar pregnancy has only placenta growth. So women have all of the signs
People.
of pregnancy.
People.
Okay. People have all of the signs of pregnancy and discover on ultrasound there is no baby in the sac. A partial molar pregnancy occurs when 2 sperm fertilize 1 egg. This results in incomplete or absent embryo development. Since a molar pregnancy causes high pregnancy hormone levels, the physician will monitor closely and may tell the person to wait 1 year before becoming pregnant again. So it kind of is that really high health, concerns there. So a chemical pregnancy can occur in the first trimester, often shortly after implementation. The hormone levels may rise, indicating conception has occurred, and then it'll just kind of plummet down. It'll just kind of drop, meaning the pregnancy was not viable. This may all happen before a menstrual period is even missed. So then there's some different types of early pregnancy losses. I didn't know kind of all these terms, but again, this was kind of nice for me to learn these terms as well, and again, why I felt like it was really important to talk about. A threatened miscarriage means you have symptoms of a miscarriage, such as bleeding, cramping, but no miscarriage has occurred. This does not mean you will definitely lose the baby, as many women or people who have these symptoms go on to deliver full-term babies. So
I had that.
yeah, so I don't know why they even termed it a threatened miscarriage. Maybe it's just
Because
kind of like it's like iffy.
Well, it's
I
because
don't
you're
know.
bleeding. Well, that was my experience. Is
Yeah.
I was bleeding, and it was like a lot.
A lot.
Yeah.
So you had to be really careful.
Yeah, I had to go to the emergency room, and an old white guy had to look at me, my 19-year-old self.
Yeah.
I'm really trying not to get political.
Yeah. I think that's a lot of times experiences is that if you're having that bleeding and a miscarriage, you go to the emergency room and you may have not great experiences. And I think that's what feeds into a lot of people and couples. And, there's just, I want to try and make it just kind of like an overall blanket because there's so many, people use surrogacies, same-sex couples, that type of thing. So I really, even if you are a same-sex couple or if you're using surrogacy, still, this is a humongous loss, that you had your hopes and dreams, set on this. And, that something like this happens, a loss happens, this still is significant and it shouldn't be dismissed. So, so there's the inevitable miscarriage. Means you have symptoms such as bleeding and cramping, but you may also pass some tissue. An examination shows that your cervix is dilated, and this indicates that you will probably miscarriage. And then an incomplete miscarriage may occur if you experience severe cramping, bleeding, and cervical dilation. This suggests that the baby may remain in the uterus. This miscarriage may complete on its own, or it may require what's called a D&C, and I really apologize if I can't say this word right, but dilation in curettage, I believe. Okay, did I say that right? Okay, I was afraid I couldn't. May have to be performed. And unfortunately, this does occur a lot, and it's very incredibly painful. I've heard a lot of stories where people experience severe pain when they're going through this experience. Providers, like healthcare providers, are not very nice. They get yelled at. They have to
Who
just,
gets yelled at?
the person experiencing it.
I have so many things I want to say.
I know. You're fiery. I know. And that's, again, this is why we need to talk about this, is that people feel they can't. And that's what it's the horrible situation of it. And I feel that talking about it hopefully will bring a lot of things.
Angry.
It makes her angry, but it should make a lot of people angry on how people are treated when they're going through this experience. Okay.
Can I just say one snarky thing?
Okay. Say a snarky thing.
I just have to get it out.
Okay.
When people with a penis and scrotum go in for a vasectomy, they're like given 5-star treatment and numbed up, like a month off work. And when people with uteruses go in for like a D&C or the birth control IUD, we're just told, just take a Tylenol. It'll be fine. But the whole gynecological field that's going to be a topic. I just decided it's going to be a topic.
Okay. You going to put it on the list?
Yeah. And we're going to talk about abortion.
Okay. We can do that. That's going to be the topic. I understand. But I can see your point, right? That a lot of times, and that was the point that I was going to bring up later, is that when coping, I think a lot of times people are told like, oh, it wasn't a baby. You have other children. So I think it kind of goes along the line, along the line, like kind of suck it up, type of thing. I'm kind of going along with you in a way that a lot of times people are just kind of said, oh, it'll be okay. Just
You're right. Yes.
Go along.
If it's a cis woman, yeah. We're often told that it'll be fine. Don't have sex for a couple weeks, but it'll be fine. Just take a Tylenol. It'll be fine.
Yeah.
Wear a pad the size of a king-size mattress. It'll be fine.
Yeah.
Legit doing a podcast on abortion.
Okay.
Okay.
All right.
Glad we had that talk.
Okay. Okay. All right. So, the causes. So I think probably the biggest thing is it's not necessarily anything that a person does.
No.
I think that's the biggest myth, is when a person experiences a miscarriage, a loss, they automatically feel, I did something wrong. I caused this.
No, or they're blamed.
Yes, and that was going to be my other thing, dear. somebody blames them. Like, oh, you shouldn't have gone to the gym and worked out. You shouldn't have lifted that thing. You shouldn't have been doing this.
Yeah, well, where were you to help me? Ooh, see?
There's a lot into that. But I think it's an automatic, the person that was carrying the pregnancy sometimes feels that self-blame, that self-guilt immediately. And then is also, in some situations, external blame and guilt is placed also on them.
Oh, society.
It is. And that's why, again, I think this needs to be talked about because it's not anything that the person is doing. Majority of miscarriages, I guess most likely a miscarriage happens because of a genetic error. So that means that some kind of an incorrect development of the fetus at the very beginning has been detected by your body. So when when there's conception and then it starts to develop, your body may realize, oh, this is not going right. And it recognizes the irregularity and things are just not going right. Other possible causes, low progesterone levels. So that is a female hormone and that helps support the embryo. So that's just something within your body. It's not necessarily because you went to the gym too much or you lifted a heavy dresser or something, I don't know. I was just trying to think of something heavy. I don't know. Anatomical concerns, infections, or early cervical openings. So those are all the more likely causes. None of that is due to
Something you did.
something you did. More of the less common but could be possible causes are blood disorders and autoimmune disorder or conditions. So there is that possibility, but they're just less common that can be found. So again, I'm getting all this information, majority of this information from this Star Legacy Foundation. I did Google some information, but this stuff is really good stuff. I can't commend it enough. Also, I heard on another podcast, which I don't think we really think about, is the sperm contribution. So the sperm contribution that is used at time of conception is actually produced approximately 6 weeks prior. So what was the person doing 6 weeks prior? Was there more caffeine intake? Was there alcohol? Was there substance use? What was going on 6 weeks prior? So it's not just a halvesy, kind of fault there. Sometimes we also need to consider what was the other contribution.
Well, the cis male will never, ever, no times ever be blamed. Another snarky remark.
Okay. And so I really, that hit me. That no, I don't think we ever take into account the other contribution because it's half and half, makes it. So
Wait, we don't reproduce asexually?
no. There was a character on the Orville that I was watching. It's a TV show, and apparently they do it. So
Okay.
yeah, Michael just shook his head and he's doing his thumbs up. He knows what I'm talking about.
Okay.
Yeah.
Oral? Okay, we'll talk.
Orville. Seth MacFarlane fan.
Okay.
Thumbs up for Michael.
Okay.
Yeah. So anyway, so that really took me back because it's like, oh, yeah, we just always automatically think of the person that may be carrying the fetus, embryo, baby. That's just kind of what we automatically think.
We don't not a baby until it's born.
My terms, I'm not a physician.
I'm just saying.
I'm trying to be as politically correct as I can here. Again, I'm just trying to talk about things. So whatever you consider, okay, or what the political...
Whatever you consider, because this is how we get in this spot.
Okay, whatever. But we don't think about the other half. And I think we need to, especially if we're going to blame. And I think that's what the point is.
But it never will happen.
But that's why what I want to talk about.
Okay. We can talk about it, but it'll never happen. It'll always be the cis female's fault.
But that's what I'm talking about right now. And I'm putting it on video and I'm going to put it on the internet.
All right?
Okay. Anyway, just think about it and just pass it along. That's why people need to subscribe and like pass it along.
I'm just going to blame every cis male now from now on.
Anyway. Okay. So, infant loss. This is probably not to say that early on loss is any easier, but as the progression in the pregnancy, I know that this loss would be pretty difficult as well. So infant loss would obviously be anything 20 weeks through full gestation and then the delivery then. So this could be that, like if you were at an appointment or something and it was discovered that there is no longer a heartbeat. At that point, if it is developed to a certain point, the person may be induced to deliver. And I cannot begin to understand how difficult that would be. Sometimes during the actual birth, something could happen. And then the infant or the baby could die. Examples could be lack of oxygen, umbilical cord wrapped around neck. And my point too is that any loss is significant. So even if it's at 6 weeks or if it's at the delivery, it's personal, it's a deep loss, and it should not be dismissed. Don't let anybody say that your loss is insignificant, even if it's at 7 weeks that, oh, well, at least you have other children, or you can always have another baby. It's okay to mourn that loss, and don't let anybody tell you otherwise. So kind of the response that I think, kind of leading into that, I guess, is going back to work, trying to resume life after that. That being difficult. How do you move on? How do you try and regain function within your life?
You're at a different baseline.
At a different baseline. How do you cope with the feelings? You're going to be feeling so many different things.
And those are all okay.
And they're all okay. You can feel hopelessness, sad, hurt, angry, all at the same time. It's like you're feeling all the feels, and it is okay.
And overwhelming.
And overwhelming. That's right. It talked about the partner. So like if there's another partner involved, oftentimes they feel like they might have to be the kind of foundation, the rock. And just to know that it's okay for them to grieve and process and handle it in their way as well. This was interesting in some of the material too, that I guess, automatically I kind of thought, but then, in the grieving process, I didn't realize that as soon as you may find out about the pregnancy or just kind of throughout the development, you envision what you want to do with your child, what your hopes you want to do for your child, what you want to name your child, what you want to decorate the room. Like you have those hopes and those dreams. Mm-hmm. And when you have that loss, those dreams are lost. Those dreams have been lost. And so that really kind of hit me too in the material. And that was a quote from a grieving father. So that I thought kind of put it in perspective as well. There was a kind of a to-do list or a checklist in one of these that if like you're at the hospital or you've had to maybe deliver or it's like maybe longer in the pregnancy. But even if you've had a miscarriage or something like that, you would be able to get a certificate of life. You would be able to name your baby. And I thought that was awesome.
Yeah, they do. They have a whole thing. Even our local hospitals do.
Yeah. And I'm sure that the hospital that you would be at, they have wonderful social workers and they would be able to help you with that. But I think also like this information, again, would help those that may be supporting that person and the family and maybe the couple. Maybe just to try and help, like, hey, can I help with this off the checklist? Or like, what can I do to help support you? I just think this material is just so awesome.
Planned Parenthood and Emma Goldman have good resources on their website.
Yes. Those are phenomenal. Really good resources. So again, dealing with the grief, we encourage, of course, if it's just so overwhelming, please seek help. Providers out there specialize in grief and infant loss or child loss. And so even the partner or other family members, children, in the one resource here, they have children's books that are focused on if there's a loss. And I thought that was awesome. So we'll make sure to put these resources up here. There's also some books that are resources for adults. So those who are going through it, that type of thing. But I really like the fact that there was books focused on surviving children.
Yeah, that's awesome.
Yeah, I really like that a lot. So we'll make sure to put that on here. So again, the Star Legacy Foundation has put out this, and they put out these other wonderful pamphlets. So the one that I have is Coping with Infant Death. The other one is Father's Grief, but I think this could be across the board. It could be partner. So I think it could be across the board. I don't think it's just fathers. And then Navigating a Miscarriage. So again, I think this is all wonderful, wonderful. And just to try and help in keeping this information kind of going and supporting this cause, K&K Speaks will make a donation to one of these agencies that is supporting miscarriage, infant loss, to help support people. So we will do a donation to one of these resources to try and help these programs continue. So that's why it's important for you guys to subscribe, to help us be able to help other people. So please spread the word, and so that we can continue to help support others. So thank you so much for tuning in today. We really appreciate it. I know, again, this was more of a somber topic, but again, that's why this podcast is so important, to be able to talk about things that just aren't being talked about. So we'll get there. So keep tuning in, guys. Thank you so much, and we'll see you later.
Thank you.